Listen to this, for the past 40 years, men have been facing infertility issues and they're seeing their sperm count really just take a plunge. No one knows for sure exactly what's causing it, but obviously a new study now revealing diet might and probably does have a huge role here. Dr. Chaffoo is here. We have examples of the food, and just on the surface looking at this doc, it's unbelievable. It sticks out like a sore thumb, if you know what I mean. Good morning. Thanks for being here.
Yeah,
this is so important. What does food have to do with it here?
So, you know, the important thing in this study that they showed in this Danish group of 18-year-old men, they studied their foods for actually 3 months, and they divided into 4 different groups. You know, those that ate like a Danish meal, typically a lot of whole grains, milk, and they found that group actually had the fastest sperm count. Groups that were in this group right here, which were what we call the prudent diet, which is a combination of, you know, of excellent sources for protein, both animal and plant-based, fruits and vegetables, had not only the best structure but the best movement for the sperm. And then unfortunately, this is the Western diet.
When I came out and I saw this, I said, this must be the American or the Western diet, as you call it, because this is just, it's horrific.
Processed, a lot of sugar, and they found problems with not only diminished mobility, but as you said, diminished counts. And so worsening in terms of fertility.
And when you have low count and low mobility, that's a problem if you're trying to get pregnant and have a kid.
It's a real problem,
Yeah, it really is unbelievable.
And then this is the vegetarian
Obviously, that's
group.
the vegetarian.
Yes, best morphology. But the, you know, the bottom line, as you said earlier on, is that diet definitely plays a role in all of this.
Were there any limitations in the study? Because I know a lot of times...
So there were limitations, exactly. So unfortunately, it was only one group. These were Danish young men. And it was only a study done for 3 months. So obviously, more studies need to be done to look at this. In fact, that Harvard did a study not that long ago where they did compare junk food and issues in terms of one's health and one's fertility, and they found both in men and women that those people that ate a lot of junk food had diminished fertility.
So this is a Danish study. I like how their review of what we eat, and they included a Danish. What are the odds of that? Okay, let's talk about the other nutrients and lifestyle choices that can influence your fertility, because I think people have heard so much over the years, diet, exercise, diet, exercise. It just seems to go one ear and out the other.
It does.
They don't realize how important this really is.
It really is, Raoul. So the important things to remember are that obviously you want to have a diet that if you're going to use, if you need protein, make sure it's more from plants and from lean meats. You want unprocessed foods. So you want foods that have not been processed for both. For example, you don't want fruit juice, you want the oranges themselves.
Fruit,
and you want to eliminate a lot of these processed chemical foods because they'll have a negative effect. We want to limit alcohol consumption. We want to limit tobacco. And instead of drinking a lot of these sugary drinks, let's replace those with water, which is the best thing we can do for ourselves.
I'm telling you, the last couple of years I've been doing that, where I think my diet used to be more of this style, and now I'm kind of leaning more towards this because it does have things that are still good for you.
It does.
And it tastes
it has the phytonutrients in it, which are the antioxidants. So those are very important elements.
Boy, oh boy. Top 5 tips, because this really involves a lifestyle change.
It really does.
It's a change of, you have to change how you think, how you approach life day to day. It's every moment of your day is about eating and what you're going to eat, right?
Yes. So you
want to get to the tips.
You want to have the 3 balanced diets a day. Make sure those diets are very high in unprocessed materials, unprocessed foods. You want to choose meats. If you're going to choose proteins, use lean meats or get your protein from plant sources. If you're going to choose carbohydrates, you want those to be more of a high fiber because they're slower to digest and they're less likely to turn into fat. We want water, obviously.
Water's so important.
So important.
Yeah. I like how we were talking about this pattern has been the last 40, 50 years or so. And it's since after World War II, when everything started, but we started getting the fast foods and the processed foods and all the stuff in our diet and our culture.
We're taking less time to eat than we should.
Oh boy, we need to prioritize a little bit more. Dr. Chaffoo, thank you, sir.
Good to see you.
Great information here. Let's get it back over to you.